Newborn babies are a miracle. How they start out as a tiny bundle of cells and turn into a gurgling bundle of joy is a topic that scientists have studied for generations. It's also amazing how they're born with miniature parts that function perfectly, at least most of the time. Occasionally, however, babies are born with defects and they end up with health problems like infant hearing loss. Fortunately, the medical field has come a long way in providing ways to screen for health problems at birth. For example, most newborns get an infant hearing test before they even leave the hospital. Sometimes, though, health problems are not always immediately apparent. New parents are often baffled by what a baby needs. It takes some time to learn what your baby's coos and cries mean. It can also take a while to know if your infant is completely healthy. Let's take a look at 5 things you can watch for to see if your baby might have hearing loss. As a newborn, if loud noises don't startle your baby, there could be a problem. You might think he's just a great sleeper, but if this happens frequently, your baby may have a hearing problem. Pay attention to whether your baby appears to hear some sounds but not others. If your baby reacts to a man's voice but not a woman's, or if he startles at the dog barking but has no response to normal conversation, he could have hearing loss. After around 6 months, if your baby doesn't turn in the direction of sound, he could have hearing loss. A child with healthy hearing will usually turn his head towards sound. Seeing what is causing the sound is one way that babies begin to learn about and interpret their environment. Beware if single-word speech is lacking by 1-year-old. Babies use their hearing to pick up language cues and clues. Within the first year of life, most babies begin to speak at least single words like mama or dada. With hearing loss, however, speech and language may be delayed. Another thing to watch for is if your baby responds to you, but only if you're in his line of sight. A baby with hearing loss may not respond to you calling him by name from behind. The earlier that hearing loss in infants is diagnosed and treated, the better. Ultimately, treatment depends on the type and cause of hearing loss. Some of the most common treatment options for infant or childhood hearing loss include cochlear implants, ear tubes, or hearing aids. If you suspect that your baby has a hearing impairment, schedule an appointment with his pediatrician or an audiologist as soon as possible. It's far better to have your baby get a thorough hearing evaluation and know for sure whether he has hearing loss than to let it go untreated and lead to possible developmental delays. Now, if only those babies came with a manual.